So what are you? More of a jiu-jitsu guy, a striker,
I like to strike. Yeah, I do it all, but I like to strike more than anything.
More of a striker, okay. These nerves right here, you see me pointing up here, these nerves go directly to his lungs. So I have to address this. Hello folks, if you are someone that's suffering from stomach pain, acid reflux, or difficulty breathing, this is a good video for you to watch. We have Dennis here. Dennis is actually a professional fighter and has been on some television shows there for contention fights, and he's suffering from a hiatal hernia, and this hiatal hernia is causing him really the inability to breathe, right? So he can't even make it through a round without being out of breath. Now, something we should note, he had COVID, how long ago?
About a year and a half.
So about a year and a half ago, he had COVID. He was out of commission for a couple weeks, for about a month. And he thinks that he developed a hiatal hernia during that time. But we really don't know for sure if it's the hiatal hernia that's preventing his breathing, or if it's the after effects of COVID, and it might also be both. But his doctors have been telling him that his mid-back pain and his stomach pain and his acid reflux and his breathing have nothing that you can't be helped by it. Is that correct?
Yeah, pretty much.
Okay, well, we're going to change that. We're definitely going to address the hiatal hernia, but he also is complaining of neck, mid-back. He has scoliosis to the right, so we're going to take a look at that, but also is having shoulder pain. You dislocated your AC joint, you said?
My AC joint separated, and I do have a torn labrum.
Okay, so torn labrum, AC joint separated in his left shoulder, and we have something in common. I just broke my hand and tore my labrum in my right shoulder. So I just did a video on that, actually. It's called a slap tear, okay? And there's certain exercises and things that you can do for that, and I'll show you that video. So it's certainly got some exercises you can start with. So let's have you stand up, okay? And we're gonna come right over here. And first, we're going to just check your clavicle. So right away here, if you can see that, you don't even need to zoom in. Look at this thumb compared to this thumb. Away so you can see it. See that? So your clavicle up here is higher. So he has been to some other YouTube chiropractors, right? And has any of them adjusted this bone right here?
No one ever touched it. That actually hurts a lot, just touching there.
Yeah, and that doesn't.
No.
Yeah. So there you go. And if his clavicle is higher here, where do you think it is over here? It's lower. You think it's going to make him move his shoulder more on this side?
No,
definitely not.
Yeah.
Yeah, he's limited there, and this one he could probably raise up all the way.
Do whatever with this one.
So we're going to fix that. He's going to do great with that. Let's just hope, though. It looks more than 5 millimeters. So it probably is separated, like he said, so we may end up having to tape it depending on how long it's been like that. How long ago did you...
This could be years.
Years. Okay.
Yeah, this could definitely be
So
years.
we're probably going to end up taping his SC joint or his clavicle down, opening up the space here. And we're going to deal with this hiatal hernia, but now I want to check his scoliosis. So I'm going to have you face that way.
Sure.
Yeah. And take your shirt off for me.
Yeah.
We're going to take a look and see how bad that scoliosis is. So go ahead and bend forward and touch your toes. Okay, so we use this thing called the scoliometer. Go ahead and do that again for me. It looks like a really, really mild case through his mid to lower thoracic spine. So come on up. It's so minor that you won't be able to see it. We've had some patients in here with scoliosis and you can see rib humping. You can see the whole part of the back humping, sticking out. That is not the case here, okay? So,
this hurts like hell here. I don't know if this is my left side.
Right here, and that's right where your scoliosis is.
Oh, okay, that hurts. That always hurts a lot.
Okay. So here's what I have you do. Lay on your back, please.
Sure. Head this way?
Yep.
Should I take me into my pockets, actually?
So you said you were having difficulty breathing. That was the main reason why you came in here. Any other symptoms? You said acid reflux as well, right?
Yeah, heartburn.
Okay.
Yeah, stuff like that.
Yeah. Tell me if you have any pain that shoots across your stomach or rebounds across the stomach.
Yeah, on the left side.
When I do that, tell me if you have any pain.
No.
Good. There. Rebounding across to the other
Kind
side.
of to the belly button a little bit.
Okay, let's do that again. How about any pain there?
A little bit.
To the other side though?
Just it stops right here.
Okay.
Right on this side.
Nothing there. So we just want to rule out appendicitis. And he has had a colonoscopy, excuse me, not a colonoscopy, you've had an endoscopy, correct?
Yep.
So he has an endoscopy showing that he has a hiatal hernia. It doesn't say what type, whether it's a paraesophageal or a sliding type hiatal hernia. Oftentimes they don't even state that in their reports, unfortunately. But the maneuver we're going to do for him is safe, and even if it's not a sliding type of hiatal hernia, it's still safe to do. We're not going to hurt him, that's for sure. But he had been told that his breathing or his inability to breathe has nothing to do with your hiatal hernia or your back. Mm-hmm. And for those of you that don't know what a hiatal hernia is, it's the hiatus, which is a little hole in the diaphragm. And when your stomach herniates through that, it creates a second stomach up above the diaphragm. And then when you go to breathe and your diaphragm wants to raise up, this is the diaphragm here, when it wants to raise up, what happens is it can't, because there's a part of the stomach that's blocking it from raising up. So it gives you that feeling that you can't breathe. That mixed with the fact that you had COVID and you're probably already having some lung capacity deficits from the start would just compound this issue and make it worse. So I can't help you with the COVID stuff, but we can certainly help you with your breathing issues if it's coming from the hiatal hernia, okay? Now, I want to check your shoulder, so I'm going to do some muscle testing on your shoulder.
Sure.
Take a closer look at the shoulder, and let's have you, okay. And I'm going to push down, and you resist. 1, 2, 3, resist. Good. Any pain when I do that?
Not bad.
Even a little bit of a strain?
Let me try again.
Let's try that again. 1, 2, 3, resist. If anything, this one was weaker.
This one
a little bit of a strain in there at all, or no?
Not an elbow, no.
No, okay.
No.
All right, relax here. Now I'm gonna have you go like this. I'm gonna push down, okay? 1, 2, 3, resist. Any pain in there?
Right here.
Okay, it's AC joint. And resist. 1, 2, 3. Any pain in there?
Oh, just a little bit actually, same spot.
Okay. Palm out, lock the elbow. And I'm gonna pull out this way. I want you to resist. 1, 2, 3, resist. Any pain or discomfort?
Just in my elbow crease right there.
Okay. And 1, 2, 3, resist. Okay, a little on the weak side. We're gonna try the other side, test that. And 1, 2, 3, resist. You notice the difference?
Yeah.
1, 2, 3, resist. You notice that side being weaker.
Yeah.
So you did test positive for SC joint. Okay, we're going to adjust that. And
okay.
All right. All right. So I want you to pick your head up, look at your toes. Any pain or discomfort in the neck?
Just tightness.
Okay. Go ahead and sit up. Swing your legs around to the side for me, please. All right. Okay, I want you to look up and over your shoulder up here. Yep, and look back, tilt your head back. Okay. All right, you can relax. Cross your arms in front of you.
This way?
Yep. And tell me if you have any back pain when I do that.
No.
Any back pain there?
Yeah.
There. Okay. All right, go ahead, stand up. We're gonna go ahead and get you adjusted, get you feeling better, and we're gonna show you guys how we do the hiatal hernia maneuver and how we treat a separated clavicle or AC joint. Okay, folks, so we have a professional fighter here, Dennis Bazooka, and we're about to treat him. We're gonna start him with some heat, get him to relax a little bit first, but he asked me a good question. Go ahead.
What exactly is scoliosis? No one told me about it.
Yeah, so he, on his report, it shows that he has mild scoliosis. What is scoliosis? Scoliosis is a lateral curve to the spine. So when you look at my spine this way, I have curves that go forward and backwards. Those are normal. We all have those curves. We're supposed to have them. Those curves act as shock absorbers to the discs in the spine. But when you look at me this way, my spine should be straight. So should his spine. So scoliosis is a lateral curve to the spine. Your spine curves a little bit to the right. So instead of it going straight this way, yours does this. So it kind of bubbles out or bows out to the right side and then comes back to center. Okay. It's milder than what I just drew on your back. It's very, very mild, so it's nothing to really worry about. I had scoliosis. I had actually a 32-degree curve when I was a kid. Oh, yeah. So that's actually what made me become a chiropractor. I had mine straightened, and I actually had surgeons tell me that I could never have it straightened, that I needed surgery, and they drilled the rods into your spine and twist them. And I was actually a swimmer. I was a highly ranked swimmer on the East Coast. And there was no way I was getting surgery. And that day, my dad happened to be playing tennis with a chiropractor. And he was late for the tennis game, and because he took me to a surgeon when I was a kid. And it's history from there. I went to see him, and he straightened my spine after a year and a half. Again, yours is mild. Mine was a severe case. And they typically recommend surgery on any curves over 24 degrees. Yours definitely isn't even close to that. Okay. So nothing to worry about. And I hope that answers to you guys what scoliosis is. So let's go ahead and get you started. Lay on your stomach.
Sure.
Okay, now we've given Dennis here 10 minutes of heat, and I'm just gonna go along the thoracic spine, the lumbar spine here. I know you said the left side was worse, correct? For you? Alright, and take a deep breath in and go all the way out. I'm starting on your good side here. And the reason I'm starting on this right side is because that's the direction of the scoliosis, and this right here is the apex of it, okay? So the furthest, most lateral portion of your spine is right through here, okay? So what are you, more of a jiu-jitsu guy, a striker, a little bit of both?
Yeah, I do it all, but I like to strike more than anything.
More of a striker, okay. And when's your next fight?
Whenever I get better.
All right, so we need to get this guy better so we can fight again. Really important. I take this seriously. You know, it's like me not being able to go back to work because of my broken hand. You see here,
exactly.
My what I do here is my everything. I love what I do. It's everything to me, just like fighting is to you.
Yep.
It's your job. It's your career. It's everything.
Life.
So
yep.
Yeah. So I take this seriously, and we're going to do our best to get you to 100% as quick as possible, so you can continue to dominate in the UFC. All right?
Are you ready to make that, or you waiting?
So now,
I just want to take out.
what we're going to be addressing mostly today is yes, his scoliosis and his thoracic spine, but mostly his shoulder, excuse me, wrong shoulder, left shoulder, and his hiatal hernia. Those are really his main complaints. Some of the other issues he's having will
Flyer, as they say, you know.
clear up as we start to address those two main complaints or issues he's having. A little tender in there.
The other one that you pressed.
Right here.
A little higher, that one. Yeah, that
Right
one.
there, okay.
I went to the last chiropractor, that felt out of place. I don't know what he did there.
Okay, take a deep breath in
I'm just
and
coming
out.
from the gym now, so I'm warmed up, and then if you want to put a
So
little
he's been
bit
to a
on,
few
and
other
put me on
YouTube
the back
chiropractors, but I'm going to assume they've never adjusted his shoulder, his clavicle, which it was really obvious. I showed you guys on camera. It's so obvious, and that should not be missed, especially if you're complaining of shoulder pain. Not all chiropractors do extremities. I do. I'm an extremities chiropractor, so I do shoulders, elbows, wrists, knees, toes, fingers, you name it. Although I'm a little limited with what I can do here because I kind of got 1.5 hands.
You know, I mean,
Okay.
I don't exact, I'm not Arnold Schwarzenegger.
Now
you
this
know,
side's
I'm not
much
lifting
tighter.
Hundreds of pounds, but you know, I do my thing. Stationary bike, elliptical.
I'm going to assume, have you ever broken your hand?
The upper body
My
bike,
hand.
which
Punching
I
somebody?
No,
love.
I'm
The
okay.
back, the elliptical's good on the back.
Yeah.
Sorry, I might be a little sweaty.
So there's actually a fracture in the hand called a boxer's
I just
fracture.
take a shower before I sweat. So sweat on at least a clean
Oh,
body.
that hurts.
Yeah. Hang in there, buddy. Take some deep breaths in and out as best you can. I know it's hard for you to breathe. So what we're probably going to do here is we're going to treat him. I'm going to also address up here his upper thoracic spine because these nerves right here, you see me pointing up here, these nerves go directly to his lungs. So I have to address this. Even though he's not complaining of any pain up here per se,
I definitely do on the left side.
you do, okay.
It gets
So,
numb up here.
okay, well there you go. So this provides nerve supply to the lungs, telling it how to function and open up and close and open and close all the alveoli in the lungs. So really huge. We had a case probably about 7-8 years ago of a guy that had such severe asthma, he was desperate for any kind of help. And the inhalers and the medication wasn't working for him. So we did about a year of chiropractic care focusing on this area here. And his breathing and lung capacity tests improved back to normal after a year. So it is possible if you have asthma to have some of those symptoms relieved, and also the nerve supply in the upper thoracic spine, as long as that's free and clear, a lot of times you can get people through asthmatic reactions where they don't need the inhaler per se. Okay, so you can certainly improve somebody with asthma. Have you ever had asthma?
No, they're trying to say I have it now though.
Because they think of COVID.
Yeah.
Working out. At least you could.
We're going to work on changing that. So what we'll do is, and you said your lung capacity, you had some lung capacity tests done?
Yeah.
And what was the lung capacity at?
It was 68. It was supposed to be at least 120 for normal.
Okay, so it was 68 and it should be 120. So what we're going to do is we're going to work on him for a couple months, and then afterwards we're going to have him go back and get another test. And I'm sure we're going to see that improve quite a bit.
You know, just like, you know, when on a really,
Okay, take some deep breaths in and out. Okay, so Dr. Kelly's going to come in here in a second and adjust this pelvis here. Okay, actually, you know what?
So awesome.
It's not bad. Here, let's have this side up. Let's have your left side up. I'm going to go ahead and do that for you here. Face me. So lay on your side. Face me. Good. And bend this top leg here. Good. And pull this arm out.
There's always something.
All right. Take a deep breath in.
What bothers me is
And blow all the way out.
balance is
Good. And the other side up. So right now I'm just correcting your pelvic misalignment. Okay. I know this is not your main complaint or main issue here. Take a deep breath in. Good. And blow all the way out. Good. Okay. Now, you okay?
Yeah.
Okay, now I want you to lay on your back. So we muscle tested his shoulder and came up with a few positive things. I'm going to clear out his neck first because all the nerves in the neck control the muscles in the shoulder. So I want to make sure that everything's clear there, and then we'll muscle test his shoulder again. Do you get any headaches at all?
I do.
Relax here. Relax yourself here. Okay, and lift your head up for me. Drop it back. Do you ever get any numbness or tingling in your hands or fingers?
Definitely, all the time.
So you probably have a disc herniation in the neck.
I think I do on the C6.
Yeah, sounds about right. So what I'm going to do here is just traction out your neck. You okay there?
Yeah, it felt like someone was gonna pop. I was hoping it would. It would have felt so good.
Yeah, a lot of people feel that. And you might get that on this second one here, okay? So what I want you to do here is just take some deep breaths in and out. And relax yourself. Lift your head gently and drop it back.
There's like one thing in here. It gets numb there all the time. It felt like it was about to release.
And that's that C6 disc herniation that you have, and that pinched nerve. I'm sure that will release in due time here. How long ago do you think you herniated a disc? Was this before you started fighting, or?
It can't be.
Yeah, relax yourself here. So we're going to do the Y strap again on you, because I definitely want to release that for you, but today's your first time, so we're going to go easy on you today, okay? We're going to adjust your clavicle now, but I want to muscle test you first. So let's start with the strong arm. Hand up, palm out, and you resist. I'm going to pull out this way and then down this way, okay? On 3. 1, 2, 3, resist. Good. 1, 2, 3, resist. Good. Relax there. Now the other arm. So I went through all the other muscle tests for him. I know what's strong and what's weak, but 1, 2, 3, resist. 1, 2, 3, resist. Okay, so this one's a little weak. Did that hurt a little bit?
Kind of in the bicep a little bit here.
Okay. And then let me go. Yes, 1, 2, 3, resist. And I feel pain up there.
Yeah, right there.
So that's AC joint test. So we're going to go ahead and adjust him, and we're going to take you into another room and do a gentle adjustment on that clavicle because it's your first adjustment. So
Alright, no
I'm
problem.
going to go easy on you here. All right, let's go into that other room. Okay, go ahead and lay back for me. Yeah. Okay, so actually sit up one more time for me. Let's just show everybody here your clavicle. And sometimes it can change with you seated, and it has. With you seated, it normalizes. Go ahead and stand up. And with you standing, it's higher. Sit down again. Still a little bit higher when he sits, but it corrects a little bit. So go ahead and drop back. And we're going to go ahead and just adjust this clavicle. It's not painful, so you should not feel any pain at all. Go ahead and look that way for me. Good. And another one. Deep breath in. Good. And again, deep breath in. And one last one. Okay. Now you're going to put this palm facing up and outward. Okay, and on 3, resist. 1, 2, 3, resist. Wow, you notice the difference there?
Yeah.
1, 2, 3, resist. Big difference.
Yeah.
Okay, now stand up and let's go ahead and check your clavicle. Boom. There you go. Big difference. All right, go home, rest. Well, you can go ahead and try to raise. Here, go ahead and try to raise this shoulder up. Is that easier?
Yeah, a little bit easier. Still definitely some restriction in the back.
Okay. Well, our first visit. We've
Yeah.
got some work to do with you, but we'll get you there. All right?
Awesome.
All right.
Thanks, man.
You're welcome. So, he had expressed that he has numbness in his stomach and his thoracic spine and radiating down his stomach, but he didn't have that until recently, right, when you went to a chiropractor. And he had an adjustment face down, but I worry that that chiropractor maybe didn't know that he had scoliosis. Now, there's a small percentage of people with scoliosis that if you adjust into the apex of that curve, the crux of that most lateral part of that curve, you're going to make them more symptomatic. So that could have happened, okay? And he should have warned you and told you, and that he would work you through that, you know, but that in the beginning it could make it a little bit more symptomatic. So I've had maybe about 10% of scoliosis patients that do get symptomatic if you adjust right into that scoliosis. If you go above and below it, they're fine. So that may be what happened there, okay? We adjusted his thoracic spine with him face up as an anterior, so it's slightly different. And what I'm doing here is I'm using cold laser therapy just to calm the muscle spasms, the inflammation, and the pain in the stomach area so I can get in there with my hands, because I have to get in there pretty deep, okay? So we're just gonna spend a few minutes here lasering your abdominal region.
There was a few times where I've like tried to massage under there and I pressed something and I literally felt it shoot into.
You felt it up into your throat?
Yeah, but like it was like right here kind of.
Okay. Because you're increasing the abdominal pressure by doing that. So
Yeah.
if you feel that when you go to the bathroom or something, like when you're trying to go to the bathroom?
Nah, I haven't felt that. No.
Okay. So when you increase abdominal pressure, you could feel that pressure radiate up into the throat. Okay.
It was like it was unbearably sharp. It was like someone was stabbing me.
And you said you were also having heart palpitations too, right?
Yeah, you'll probably see it if you take that off. You'll probably see it jump through here.
So we have the vagus nerve that runs through there. The vagus nerve is a
I know
really
about the
important
vagus
nerve when it comes to your blood pressure.
Yeah.
And also it produces hydrochloric acid. So when it's being pinched or compressed, it can produce or trigger that vagus nerve to produce more acid. And that's why you get the acid reflux. And that's why a lot of people get relief with their breathing, with their heart palpitations, with their acid reflux, and their stomach pain all at once from this maneuver. We're just adding laser to it just to calm the inflammation down, just make the procedure a little bit easier for you today, okay?
I was reading that COVID can affect like inflammation on the vagus nerve, which could be why a lot of people have that. So I mean that makes sense. I
So
just
if
said
that's the case, what I'm going to do is I'm going to put the laser right over the vagus nerve right there so we can calm any inflammation down, because this laser calms inflammation down. It inhibits nerves. So this will inhibit the vagus nerve if we need it to or want it to. So that's what we're going to do, okay?
Thanks,
So I'm going to do a couple spots.
thanks. Because this'll hurt anytime I try to breathe
Okay.
in here, like this, and especially.
See,
in
but
here.
the reason for that, just to be clear, so a lot of folks are watching this video, this pain he has up in the front of his neck, above his clavicle, it's got nothing to do with the vagus nerve. It's got to do with his clavicle being out and his shoulder out, which we have, we've corrected, but it's because of your clavicle, and that's why you have that pain into your into the front here. Okay, it's got nothing to do with the vagus nerve. And one last spot right here, and then we're going to do the hiatal hernia maneuver on you. Okay. So before you came into the office this afternoon, what kind of symptoms were you having as you were coming into the office?
Just nausea, like I'm about to throw up, acid reflux.
Do you ever regurgitate your food?
No, I haven't. But it's gotten really close. Like today too, I had eggs in the morning and then coffee like a few hours later. And both times I almost threw them both up.
Yeah, you should try to avoid the coffee.
Yeah.
Yeah, just for now.
Okay, I definitely drink a lot.
Coffee's going to cause peristalsis.
Okay.
God, and that could just aggravate.
I'm just always so tired, you know.
So you feel like you need the coffee just to keep you
literally
going.
get by, just to get by the day.
Okay, you ready? Stay just like that. Keep your knees bent. Okay, take a couple deep breaths in and out. You might feel gas, regurgitating, burping, belching. That's okay. You okay there?
Yeah, that hurts a lot.
Yeah. It's gonna get easier, I promise. Okay? There you go, you hear that? I'm sure you heard that.
Yeah.
Hang in there, take another deep breath in.
You know, every time I do try to take a deep breath too, I'll feel something clicking in there.
Okay.
I know if that makes
it's hard
sense.
for you to breathe in and out. It's
Yeah.
it's that friction in the hiatus. Okay. All right, let's do another one here.
Hi. Good. How are you? How'd you do after the last adjustment?
My body's working.
Yeah. I'm sure you felt that. We're gonna do one more here, okay? All right. Take a deep breath in and out.
They're fighting, but it's good.
We're gonna start him with heat first.
Yes.
So go ahead and lay down on your stomach.
All right.
I got it.
Oh, maybe for later. It's the wrong hoodie. grip, okay?
Okay, on that last one, I'm sure you felt some movement there and
Yeah.
some crackling. You felt a
Yeah.
little bit of crackling. Was that the feeling you feel when you're
Yep,
breathing in?
Yep. Yeah.
So what I'm doing here is I'm pulling your stomach down from the diaphragm, back down underneath the hiatus. Does that make sense?
Yeah, it does. It
And
feels
when
like
you
that's
come
all
in
soft.
on your next visit, I'm going to show you a 3D video of what a hiatal hernia looks like, so it makes sense as to what I'm doing
Okay.
for you. Okay. All right, we're going to do one more here. Take a deep breath in and just blow out, and relax on each exhalation. Good. And again, deep breath in. Yeah. You can hear that regurgitating already, right? Good. And okay.
Oh.
All right, that's over. This is a UFC fighter, and he could barely take it. It's painful, so it's not comfortable. But when you let it get really chronic, it becomes more uncomfortable and more difficult to deal with. So don't let your hiatal hernia get this bad. Okay, stand up. Let's take a look. Come on around the table over here for me. I just want to make sure that your clavicle's still in place. Okay, so let's face the camera here. And it's already out of place, as you can see here. So we're going to have you lay down facing that way.
Sure.
Okay, and stand up facing me over here. There we go. Good. All right. You're going to be sore here.
Okay.
Okay. And you might even be sore in here.
I feel it right now. Yeah.
Let me know.
It's all good.
There's a lot we can do to calm that down. I'm going to see you again on Friday.
Okay.
All right?
I'll be here definitely.
Okay.
Thank you.
We'll get you through this. You're going to be
Yeah.
fine.
Thanks,
okay?
bro.
All right. Thanks for tubing in.